This is 10-minute discussion on the rationale of choosing Gestalt therapy and person-centered therapy as part of video assessment on Gestalt therapy and person-centered therapy. My role as a therapist to a Pamela, 20 years old student, university student. In this rationale, I would choose person-centered therapy as a therapy who would provide environment for Pamela to explore herself and giving a genuine and positive regards, congruent relationship, building relationship with Pamela and giving empathy and giving him a safe environment to be herself and giving her an opportunity to explore about a perceived self, an actual self, and ideal self that lead her into self-actualization. So as a university student, Pamela is fresh actually in experience and also energy that she could discover in herself by giving her person-centered therapy. With this person-centered therapy, hopefully Pamela can explore more about herself, especially her involvement in alcohol, and it's just like too young to involve in such alcohol problem, and also that. And in this person-centered therapy can help support Pamela to see what is happening in her life, what is actually she perceives about herself, and what is actually the actual self, and what person that she would like her to be as a young person, that there is so much future for her if she's able to move into a place where she can understand about what's going on in her life. And Gestalt therapy will be a therapy that I would use for her to bring her into awareness of what is happening in the present, to bring her into awareness here and now, where she has problem to become an exotic dancer. There's something underneath of that rejection or over reluctance into becoming exotic dancer. There's a lot of things to be explored, and using Gestalt therapy would be an option to bring her into therapy, and also confrontation, bring her into confrontation about here and now, bringing her with Gestalt therapy will be able to take her to the past, that influence her present or here and now experience. That awareness is coming with the Gestalt therapy. And also using the empty chair, I would use the empty chairs also to confront things, and also by allowing her to think about herself, but also giving her homework and also relaxational technique to ease the stress and the pressure when she is thinking about becoming an exotic dancer. There is so much pressure in Pamela's life, and as a 20 years old university student, and my role in helping Pamela, somehow it's not easy. There is a lot of challenging that I found in the beginning of the building relationship with her in this counseling relationship and building rapport. I have challenge. I need to grow in that part. I'm not familiar with both two techniques yet. I'm still learning about that, especially in confronting issues in Pamela, using the right question and knowing what is actually when to bring her into awareness and when to present it the empty chair. That is something that that I need to learn more about it and practice more about it, and reading or finding more resources about using these two techniques. But somehow Pamela, as a young girl who is a university student, there is so much hope in her life if intervention or therapy that given to her can be effective. But somehow if her alcoholism or her involvement in alcohol getting worse, there should be an opportunity for referring her to maybe a group, anonymous groups, alcohol anonymous group. Also can refer her into rehabilitation, alcohol rehabilitation center if it's getting worse, and also can refer her to a student loan agency that could help her come through, get out of the problem, that she doesn't have to become an exotic dancer. So there is an opportunity for referral for her when exploring more to help her.